Childhood disintegrative disorder is a condition in which children develop normally through age 3 or 4. Then the skills they have acquired over time, such as social, motor, language, and communication skills, begin to regress. There is no known cause for CDD. CDD is also known as disintegrative psychosis or Heller's syndrome. Thomas Heller first described CDD in 1908. CDD children develop normally up until about the age of 2. A CDD child will stop being social, stop speaking, stop walking, and lose control of their bowel movements within months after the appearance of their first symptoms. 90% of CDD children completely lose the ability to walk and to feed, wash, and toilet themselves before age 10. Around age 10, a CDD child will reach a stage called the plateau point, and their developmental skills will stop regressing. However, the skills that a CDD child loses during the developmental regression period will never be recovered. CDD affects 6 major areas of functional development. Area 1. Expressive language skills, the ability to speak and communicate thoughts. Area 2. Receptive language skills, the ability to understand and process information. Area 3. Social and self-help skills, the ability to interact and relate to others appropriately, and the ability to take care of oneself, such as feeding and washing. Area 4. Bowel and bladder control skills, the ability to recognize when one needs to use the bathroom, and the control of not using the bathroom on oneself. Area 5. Play skills, the ability to understand basic rules, understand concepts like sharing, and understand that playtime is over. Area 6. Motor skills, the ability to walk, hold oneself up, grasp objects, and control muscle spasms. As CDD children begin to lose their basic functions, they become afraid and confused and quickly panic. CDD children find it almost impossible to understand why they can no longer complete tasks they could do the day before. Once CDD children begin to lose function, they develop problems such as bipolar disorders, panic disorders, anxiety disorders, depression, antisocial disorders, and psychosis. Children with CDD are often mistaken for children with childhood schizophrenia or simply searching for attention. There is no cure for CDD. Children with CDD require speech, occupational, physical, and mental therapy from infancy through adulthood. Close to 100% of children with CDD receive antipsychotic and antidepressant medication for a lifetime. Children with CDD do not spend much time in a standard classroom. Children with CDD are only taken to standard classrooms for social learning and interaction with others. It is hard for children with CDD to learn in a standard classroom because they have trouble with focus, they tend to be violent without reason, and they are afraid of images and sounds that they cannot process. Children with CDD cannot learn through observation. Children with CDD have trouble using learned information in an environment different from where the information was learned. The prognosis for CDD is bleak. Although the body will grow normally, the child's level of function will never change. Adults with CDD require the same care as that of a toddler. They are either given live-in assistance or institutionalized. All we can do is understand.